This thumbs up may tell you of his attitude despite what's up. In 2017, Stephen Irongo was diagnosed with kidney failure right after high school, just at 20 years. The burden of the costs has thrown him into dark spaces, and his mother, Jennifer Irongo, is here to attest to it. Mother and son will be in the dock as Helen Aura seeks to draw out details of their experience before this court. Judith Toto's husband was a watchman at a school in Busia. He was attacked by thugs while at work. The hospital allegedly refused to attend to him because he did not have enough money to pay up front. He died. Oko Kusa will lead us into the recently widowed woman's sorrowful submissions to this honorable court. And pharmacists are accused of bagging the big bucks on your bills, even illegitimately. Dr. Joseph Kadhare, the Vice President of the Pharmaceutical Society of Kenya, will respond to this and give us his prescription of the situation. The deep-voiced, family-vocal Secretary General of the Kenya Association of Private Hospitals, Dr. Timothy Olwenyi, is clear about a lot and will address the accusations that private hospitals are exorbitant. The Director of Clinical Services and CEO at Evans Surprise Medical Center in Nakuru will be facing Zainab Ismail, who will be interrogating him on the dynamics around private hospitals and the cost of healthcare. Rashid Aman will also make submissions to this court. Rashid is a man who has been in the limelight for his role as the Chief Administrative Secretary in the Ministry of Health. He will make submissions on the government's efforts to make healthcare affordable before this honorable court. Welcome to News Court. Here we prosecute matters that matter. We table submissions and let you be the judge. In this session, we delve into the concern of expensive healthcare. Your Honor, Justice Wanjiku, court is in session. I call on Helen Aura to make her submissions to this court.
Your Honor, the myriads of motions that come with being unwell can be quite draining. Add this to drained resources. I would like to ask you to imagine, but there's really no need to do so. We have in this court a real-life testimonial. Your Honor, I would like to invite 25-year-old Stephen Irongo and his mother, Mrs. Jennifer Irongo. Stephen, what was going on through your mind at this time, and has it changed or affected your life in any way?
I was so terrified before I was diagnosed. My brother had the same issue, my eldest brother. Na nilipogundua ni kwamba pia nami niko na ugonjwa huu, nilishikwa na wasiwasi sana.
Pengine tuende kwa mom Jennifer, waweza tueleza safari imekuwa vipi?
Mimi nimepitia mambo mazito sana. Pesa, unajua hata chakula, ukijua kile huyo mtoto atakula ni shida. Kwa sababu lazima upike, ule daktari anataka umpe hizo chakula. Hata si kujua kama atamaliza hiyo mwezi. Wakati ile niliambiwa ako na ugonjwa. Kwa sababu huyo mwingine wa kwanza alimaliza tu mwezi mmoja akawaga. Sasa huyu akishikwa, hata huyu nasema Mungu wetu, hata huyu ataenda mwezi mmoja. Hiyo mambo inakuwa mzito kwa roho yangu. Kazi ni kazi tu ya soko, kwenda kununua tu vitu. Ndio hawa watoto nione kitu ya kukula na madawa na pia ya kuenda Kenyatta. Lakini kazi ikakuwa chini, unajua pesa zote unapelekea wahoshi.
Per treatment inakuja kwa inagaramika kwa pesa ngapi?
Wiki moja anakula 18,000. Madawa unanunua ya grade 7 ya 15 ndio tuone infection yake kama itakuwa sawa.
Pia kuna test mtu anafanyiwa. Zingine huwa zikavi na NHF. So kama hizo utapata unatumia like 3,000 one test. Zingine inalingana ni gani daktari amekuandikia. Maisha yangu imesimama kidogo. Juu yale mambo ningefanya nikiwa healthy. Sasa siwezi yafanya. Juu naangalia nilimaliza high school nikagonjeka. So singeweza kuendelea na masomo. Juu most of my time nilikuwa na spend kwa hospitali. Saa zingine ni ngumu sana kufanya kazi. Like for me now naenda mara 3 kwa wiki. For those 3 days sitakuwa kazi. na wiki iko na siku 7, tunabakisha siku 4. Sunday niko kanisa, tunabakisha siku 3.
In the line of one of the patients who are in line to receive a kidney, how much have you been told the process will cost you?
This treatment will cost approximately between 900,000 to 1 million. That is in a public hospital, Kenyatta. But if we decide to go into a private, it will be more. Juu kuna moja tuliulizia na tukaambiwa hiyo itatucost 3.5 million.
And this is what we call the shilling reality. Your Honor, I rest.
My lords and ladies, to stay on this thread of conversation, our hybrid court will now allow Ouko Kusa to make his submissions to the court.
My lords and ladies, the sting of death is piercing. It takes away a part of you that can never be replaced. Your Honor, I submit that the circumstances under which one passed away hold a very significant implication in the lives of the bereaved. When it is a matter of affordability, it becomes harder to afford that elusive closure. We have a first-hand account to submit to this court.
Hospitali ya kwanza mahali alipelekwa ilikuwa Kocholi, akakataliwa. Hospitali ya pili ilikuwa Bungoma, na kulikuwa na fedha zilikuwa zinatakikana aweze kuwa admitted pale. Lakini kule Bungoma waliweza kutuitisha shilingi 20,000 cash ndio waweze kumadmit, ambaye ilishindikana. From there akakuja akapelekwa Bungoma General mahali aliweza kuwa referred apelekwe Eldoret. Kule Eldoret wakiwa njiani waliweza kuongelesha hospitali ya referral Eldoret kama tunaweza pata kitanda ICU, lakini haingeweza kupatikana. Instead aliweza kupelekwa Medhill. Kule Medhill ndiye aliweza kupokelewa, lakini shilingi 50,000 ilikuwa inahitajika, ambayo ilifanya tu kwa msaada mchango wa pale huku na pale ikawezesha yeye kuwa admitted. Ilikuwa already 700,000. Tukaambiwa tukilie hiyo bili kwanza, ambaye haikuwezekana. Wakatuambia kabla hatujakilia hiyo bill hakuna chochote itaendelea kwa mgonjwa. Kesho yake ndio mgonjwa alikuwa wamfanyia fasting ili aweze kupelekwa theater, lakini haikuwezekana kwa sababu tulikosa pesa. Friday already bill ilikuwa imefika 1,000,000. Mgonjwa hajapasuliwa, hajafanywa chochote. Tuliweza kudeposit hiyo title, tukaweza kuleta mgonjwa referral. Kwa ile muda ya miezi 1.5 karibu 2 akaaga.
Saisi sisi familia hospitali na tudai 800,000. Na sasa ndio tunaomba kama mtu mwenye ako na roho utu aweze kutusaidia. Tuweze kurudishia mwenye alitusaidia hiyo title deed yake.
Your Honor, this account leaves nothing much to add, but also leaves a lot of room for questions and desires for changes.
Your Honor.
Your Honor, I believe that it is only befitting that this honorable court examines the exhibit presented. Your Honor, the receipts.
Well, Your Honor, with your generous permission, if I may. We sampled some receipts that show what Stephen Irongo and his family have had to pay for his treatment across the past few months, and these are not the only things he's paid for, just samples. On this one, he had to pay 9,000 shillings for a limb Doppler ultrasound. On this other receipt, we see he paid 1,527 shillings, which was for different medicines. Here, we have a receipt of tests ranging from H. pylori to blood tests, which came to an amount of 2,850 shillings. Then, still, more medication paid for at 1,820 shillings. Then, more tests which come to a total of 5,900 shillings. And on this receipt, we see yet again another set of tests which come to a total of 2,800 shillings. So, quite a number of insights and questions that can be asked. And on that point, allow me to ask Zainab Ismail to take the floor.
Your Honor, when you speak of the high cost of medical care, well, one of the most immediate thoughts that crosses many minds is hospitals. And some have been accused and stand accused of being in the business more than the service. Well, is this the case? In this case, allow me to call to the stand Dr. Timothy Olwenyi, the Secretary General of the Kenya Association of Private Hospitals. I thank you, Dr. Ari, for joining us on the stand. Private hospitals have been accused of being profit-driven. Is this a fair assessment on your side?
It is fair, but I think it needs to be put in context. First of all, anybody who's been to business school will know that you set up a business to make profit. So I don't think being profit-driven in itself is a bad thing, because that is the reason why people...
At the expense, allow me to object, at the expense of the lives of Kenyans who wish to seek that medical service?
I would not say at the expense. Let me put things into context. First of all, medical care, we have got different types of facilities that offer medical care in this country. They are different in terms of their ownership, in terms of their structure, in terms of financing. Public facilities are funded by the exchequer. So much as we might say that public facilities are cheaper, they are cheaper because we prepay for that service, for part of that service. That's why they inevitably will charge less. Private institutions, on the other hand, do not receive any external funding. So everything that is within private institutions is paid for by the people who walk in through that door to get the service.
Unfortunately, in many instances, you are asked to pay up front before any service is delivered.
It depends on the circumstance. If you are asked to pay upfront in an emergency situation, that would be morally and ethically indefensible. It is even illegal. As per our law right now, emergency services, you are entitled to get emergency service at any facility, public or private.
What really needs to be done holistically to be able to expand access to medical services across the board?
The financing of healthcare, we must advocate as much as possible for pre-financing of healthcare services. What do I mean by that? I mean that people do not need to pay for the service at the point of receiving the service. It needs to be paid for in advance. Therefore, we have to pool the resources. Pooling resources means, for example, through NHIF as a social health insurer, you make your 500 shilling contribution every month, and on that basis, you are assured that when you get sick, you'll be able to get service. But if, for example, we had a situation where everybody, for example, had got some form of insurance cover, that should be ideal. Then it means that at the point of seeking care, there is minimal financial contribution. And that is the only thing that will save people from going into getting impoverished because of healthcare.
Thank you. Your Honor, you had the private hospitals representatives. Are you convinced? You decide. You be the judge. My lords and ladies, I rest.
Your Honor,
Your Honor, if I may, from my first-hand witness account, medicines play a significant role in a patient's life and even in the accumulation of the bill. And meaning this means the pharmaceuticals are one of the biggest beneficiaries of the burdensome bills. Do they agree? And do they feel that this is morally sound to make all the money at the expense of a patient?
Your Honor, if I may just take back what I should be saying. Fortunately, we have the response of the pharmacists to submit to this court.
It is not true that there is so much money in pharmacy, or pharmacists are making a lot of money. If the hospital bill is 1 million, you realize 800,000 is from drugs, or 500,000. The reason is the billing of these drugs by physician or the doctors. If they prescribe certain drugs every day, there is no one that is sure that the patient was given those drugs. The moment you are sick and you have told your drugs will cost $1 million, you have no option, Mwangi. So we need to have, this is where we need to say, we need to have a pharmacist in every hospital who is giving a report that actually Mwangi is supposed, he was treated with the drug worth 200,000. But it is not carving the price the way the minister or the cabinet secretary was saying, that we can fix the price. What are you fixing? If I had, like, you know, when we had COVID, Mwangi, to Zurubab injection, it was trading almost 600,000, and those, nobody talked about it. Poor people died. In businessmen, they have taken over. They have taken control. We can't even breathe. That's why even cancer, they are taking anyone there. They want to take control. If Mwangi, you are a billionaire and you are owning like a chain of pharmacies, in Nairobi CBD, you have 20 of them. Kisumu, you have 10 of them. Meru, you have 10 of them. Now, how do you expect a pharmacist to control that?
Justice Wanjiku, if there are no more interruptions, let's get into the policy and government position on this whole matter.
This country, a large proportion of healthcare is provided by taxpayer money through public institutions such as this one here. The government is not the only one that can provide or should provide healthcare services. We recognize that healthcare services can also be provided by the private sector, but under certain terms and conditions, and we have to oversee them as government to make sure, one, that their costs are affordable to most Kenyans, provided they are able to work within those conditions of making that fair and reasonable return on investments. We welcome them to be part of the team that is providing healthcare services. At the end of the day, we want to see that working together, the costs of service are down, and that we do not place our citizens in a position where they are driven to financial difficulties. This is basically the entire UHC is built on this fact. Once we have a very clear idea of the cost drivers that I told you about, we will institute certain measures that make sure that costs of prices are limited. There's some ceilings to some of these costs of prices. And we are, of course, working on that, and very soon we are going to see, because it is part of our UHC journey, we're going to see that we work in that area to make sure that these costs are affordable.
On one hand is a bill that's all about the dough, cents. On the other hand is a cannula on a person to whom it makes no sense. For one, it's a strong scent. For the other, a raw stench. A stench and a stretch that to them translates to wretched. For the former, it's a livelihood in a system that's so wrecked. In the red. Patience pays, but not all patients pay. And this is not a doctored saying. When the bills are as threatening as bullets in the pistol, those who are not treated right are left to turn to epistles. Some heal, but cannot have a fiesta because it's hard to afford. So they resort to a siesta, take some sleep. This could invoke emotion. It could even be a surge. Justice Wanjiku, you've heard it, you've seen it. You be the judge. And this is News Court.